Good morning, everyone. Welcome to our weekly COVID-19 media briefing. I'm Kerri Schuette. I'm the Public Information Officer for the Shasta County Health and Human Services Agency. Today, as of Monday, we've had 511 confirmed cases, including 3 from Monday. We've done a total of 30,541 tests. We have 6 people in the hospital, including 4 in the intensive care unit. We've got 27 people in isolation, another 195 on quarantine. And as our weekly reminder, quarantine is people who have been close contacts to people who have tested positive. We have 33 active cases, and we have had 467 people released from isolation to date, and we have had 11 deaths. And those are our updates for the day. I wanted to let all of you know that our representatives from Shasta Regional Medical Center and Mercy Medical Center are not going to be joining us on our weekly calls any longer. Back in the beginning, when we started doing these briefings back in March, when they were daily briefings, there were lots and lots of questions for the hospitals. And so we wanted to make it easy for reporters to access all of those folks at all times. It's been a while since our hospital folks have gotten, a large number of questions, so they will be just using their regular public information offices to answer questions from the media as needed. Today we have with us Matt Pontus, the CEO of Shasta County. Donnell Ewert is the director of the Shasta County Health and Human Services Agency. Karen Ramstrom is our health officer, and Michael Vivakis is our deputy health officer, along with our media partners. And then Jen from Mountain Valleys is with us today as well. Does anybody have anything that they would like to share with us right now? Okay, I think we are ready for media questions.
Well, I'll start. I'd like to ask, I guess, either Donnell or Dr. Ramstrom, how are things going with the RANCHO and the regional approach to COVID now? Where are we? Where's the state at right now?
So we have our standing meeting with the state tonight, and so we're hoping to get more information then.
But can you tell me anything about where we are right now?
So nothing's really changed. They have been surveying the health officers to determine how to define the regions. And then my understanding is they're having internal discussions about what that will look like and also how to use the regions. And so I don't have any details on that. Sorry, Mike. So we're hoping to get that tonight. I know that they've been having conversations, but that's all that I know. I think they're trying to figure out how to align those decisions with what they're doing with the county monitoring list and any updates to that state health officer order and that process, just based on lessons learned so far. So I think they have a lot of those pieces to take into consideration as they're making the decision about regional approach.
Do you know if the regions would be at all geographical or more toward the number of COVID cases?
So they sent out some options to local health officers and had us vote. So they had there's several existing regions. So they were asking, should we use existing regions like our emergency service regions or our CalFresh regions or economic regions or sort of what's been happening just with how the health officers are sort of organically organized themselves. So there's a health officer region. So they did a survey and they were still finalizing that a few days ago, and that's the last I've heard.
And finally, what advantages does regionalization give you?
I think it's going to depend on how they set it up. Our hope is that will give us a little bit more flexibility in that we are not, all of our jurisdictions are not having the same experience in terms of disease transmission. And then that regional approach, I can just tell you from our experience, is so helpful because we're all learning. And so we're on the phone together talking about, what have you done in this circumstance? What did you learn? Have you thought about this? Have you had this question from constituents? What did you do? And so it just makes our decisions richer, and we're better informed based on the learnings so far from each other. So I think that's part of it. And then the other piece is, with all of that in mind, it depends on what the state allows us to do. If they use this for decision making about, our non-pharmaceutical interventions, then we'll be able to make those decisions together and decide whether we all want to have the same approach or we have certain parameters of how we do that. It depends on how the state sets it up. So we're just hoping it'll give us more local flexibility, but what that looks like, we're not sure yet.
Any timeline on when the state would set it up?
We're hoping to learn more tonight. Yeah, sorry.
That's okay. Thank you, Doctor.
Hello, everyone. My name is Alexandria Williams. I'm with KRCR, and I had a few questions. I was really interested in knowing if anyone could elaborate on the expectations regarding, I know with COVID, a lot of salons and barber shops have been asked to practice their hairstyles and just everything they're doing outside rather than in their salons. So what are the expectations right now for hair salons and barber shops because of COVID?
So nothing has changed there since those guidances came back. I can't remember now. Back in June, I guess it was. So I'm not sure exactly what you're asking about.
So I know some of the salons have, maybe some of them haven't been following the mask protocol or social distancing, so just the basic guidelines that you would give to all those businesses in general, salons and barber shops that are still doing business.
So we haven't heard from as far as I know. Kerri, you might know. I don't know that we've heard from particular issues in particular salons having consumer complaints or anything like that. We know that many of them have taken steps to implement the modifications, and just like any business, some of them may have had employees impacted, then they have to decide what to do. Like many of our businesses have had to do that. So, but I don't know about any particular complaints or repeated complaints about any particular salons. Others on the call might know, but I'm not aware.
Sure. Do you know if, is there probably going to be a time if things get worse with COVID, would salons need to start working outside rather than inside salons?
If I recall correctly, they would move to outside if we get on the county monitoring list. And I don't know how that's working in other counties, but I think that would be pretty challenging. Some might be able to do it. I don't know. And I also don't know what the rules are around that for that industry specifically.
Thank you.
Also, I just want to mention that on shastaready.org, we have all of the guidance for all those different salon type services. There's many different sets of guidance, one for electrology, one for anesthetician, skincare and cosmetology services, another one for nail salons, massage therapy, hair salons and barbershops. So as far as expectations for those businesses, those are all up on our website.
Thank you, Mr. Ewert.
To follow up on your question about non-compliance, we have not, that doesn't seem to be a group that we've gotten a lot of complaints about in terms of people not following the requirements. It seems like most seem to be already, it's an industry that's very, very careful about hygiene and cleanliness and things like that. And we have not heard a lot here about that being a situation, though you could probably check with the cosmetology board. They regulate hair salons and barbershops.
Thank you.
Hi, Steve Gibson, KQMS. When is the seasonal flu shot usually become available, and will there be delays this year because of the confusion with the similar symptoms to COVID?
Usually comes out around September. There is a lot of work going at the national and state level around influenza vaccination. There's a big push of doses out to the states, and so that's sort of in the works. And have a group of staff that are working on preparations for that and what that might look like in partnership with our clinics, and what we will do as far as any drive up type of flu vaccination options versus what providers will be doing. So there's a lot going on in that area right now. And I do know it's a big emphasis at the national level to get vaccine out soon, as you alluded to prevent any confusion. One, to prevent influenza, but then also to prevent any confusion of symptoms that might be similar to COVID.
And is that usually determined somewhere? I mean, it's like a moving determination, right? Where it's observed which particular flu strain is going to be most prevalent, and that's the one that they designed the vaccine for. Is that correct?
Yeah, the influenza vaccine is updated every year, and so that manufacturing has been in the works this August. So I'm sure, there's millions of doses that I understand are on their way when they're ready. And so there's been a lot at the national level this year to make sure that the influenza vaccine supplies ready to go. So it's in the works, and so but the manufacturing and all of those decisions you're talking about would have been made upstream prior to manufacturing, because we're getting close to it coming out next month most likely.
So is that not correct? That is it not a strain specific vaccine each year? Is it different each?
Yes, it's updated every year, but that manufacturing would have started a few months ago. So all of that decision, that's already in the works. That's already happened.
So they would already know, I'm sorry. So they would already know at this point what the prevalent strain is going to be this year?
As far as I know, I haven't really been tracking it as much. That's happening. We have a team that's working on that. And so I haven't seen anything. But just based on what I've heard about the national preparations and the large number of doses that are going to be available, and the timing of how that's done every year, then the manufacturing and how long that takes. But I just haven't seen a lot of information come out. I haven't, it is what it is. So I haven't necessarily been paying that much attention to it, and I haven't seen a lot come out yet. And it will, I think, be coming out more from CDC as that vaccine is pushed out.
Okay, thanks. I don't understand the process very well, because last year was the first year I got a flu shot, so I just never really paid that much attention to
it. Steve, thanks for bringing up flu. Flu is very important. We have a vaccine against the flu. Right now, we don't have a vaccine against COVID. So something everybody can do is get the flu shot. It is widely available in the community. You can get it from your medical provider. You can get it from pharmacies. It is paid for through insurance. It's supposed to be made available for free for anyone with insurance. So it is widely available. The way they manufacture the vaccine, it is a long process because they use eggs, and they have to incubate them for quite a period of time to create and to manufacture the vaccine. So decisions are made, I think, in January about which strains to put in it. It's based on the previous year's activity or the activity they're seeing in that year. So, it's a little bit of a prediction that they have to make. And we always hope that there's a cross immunity with the strain that's circulating in the following year. Influenza does drift. So the genetic material does change slightly every year. And, we always hope for that cross reactivity so we have protection. And we also can see what's transmitting in the Southern Hemisphere during their winter. And again, just like Dr. Ramstrom, I'm not completely up to date on what they found from that. However, it is a trivalent vaccine, meaning there are 3 strains. There's 2 influenza A strains and 1 influenza B strain. And everybody age 6 months and older should get a flu shot.
Do the precautions that we're taking for coronavirus make us more prepared to defend against the flu?
Wearing a mask.
We're all hoping. Yeah, we're all hoping that all of these personal protection measures are are really going to influence our influenza season as well, and cold and flu, all of those, because the hand washing, the mask use, staying home when you're sick, all of those are similar recommendations for these other infectious diseases.
We will also, as we do every year, we'll have flu shot information widely available through our agency. We just sent out a press release about back to school vaccinations. And once we have details, specifics on how and when to get a flu shot, we will make sure that everyone is informed about that. Other media questions?
Yeah, I have one. Mike Chapman, Record Searchlight. Let's see, Waterworks Park has been in the news, and Shasta Caverns recently. I'm wondering, are there any other businesses that public health is working with that might be a little resistant to the rules they're supposed to follow?
Is that me? We do have we have a business engagement team as well as a community engagement team that have been following up on feedback that we have been receiving from community members. Sometimes community members also reach out directly to businesses in other places, but we do follow up with those businesses, and in some situations we have assistance from environmental health, which already does regulation of our local restaurants. ABC does regulation of places that have liquor licenses. Cal OSHA, there are some other state organizations that are involved in reaching out and making sure that businesses are aware of the requirements and complying with them. At this time, I can't tell you any specific businesses with which we are actively engaged, but there are many hundreds since the beginning of this outbreak that have been working with us to make sure that they are open safely.
Okay, thanks. One other question related to the regular flu. Do you think that maybe we'll have a real low flu rate this year because of all the precautions people are taking?
Right, so that's what we're hoping, that these prevention measures that are in place for COVID-19, hand washing, staying home when you're sick, keeping your distance, wearing the masks, all of that, we're hoping will influence all kinds of respiratory types of infections, whether it's a cold virus or influenza. So we're hoping, but that is not a substitute for influenza vaccine. And so it's really important that people get the updated influenza vaccine on an annual basis. And as Donnell mentioned, that's for individuals over the age of 6 months. And there's certain high-risk populations for sure, people with health conditions, pregnant women, people planning pregnancy, others that we really encourage to do that, but it's for the entire population. And the more people that they get their influenza vaccine, the less transmission of influenza we have in our community.
Great. Just one quick question. I was surprised. I walked into my pharmacy the other day and they're already offering flu shots. Is it too early to get a flu shot?
It may be that some is already trickling out. It's a little bit early, but usually it's September, but I wouldn't be surprised if some of it. And so, but our larger supplies will be continuing to come in. It's not too early.
Okay, thanks.
Yeah, that's a good question. Yeah, the flu season does vary from year to year as far as when it peaks. So we can have early flu in late November and December even, or we can have a peak in February. But it does start circulating as soon as the weather turns cooler and people start congregating inside more. That's again how it's transmitted, by people crowding together more. So it's advisable to get the vaccine as soon as you can.
Other media questions? All right. Thank you, everyone, for joining us today. We will be back again next week at 11 a.m. Same place. Everybody have a safe and healthy week.